Listen carefully, because the most dangerous lie about bullet wounds is the one that sounds comforting. If you're still breathing, you're fine. In a collapsed world, a gunshot doesn't kill you the moment the trigger is pulled. It kills you later, quietly, through bleeding you didn't notice, infection you underestimated, and shock you thought was just fear. When there are no ambulances, no antibiotics, no surgeons coming through the door, the wound becomes a countdown timer, and whether you understand what's actually happening inside your body decides how much time you have left. The first thing you need to understand is that bullets don't just punch neat holes. They dump energy. Tissue stretches, tears, and snaps back, crushing blood vessels you can't see. That's why the wound that isn't bleeding much can still be fatal. Your priority is not heroics. It's physics and blood volume. You stop the bleeding before you do anything else, because an adult can bleed out in minutes, long before pain or infection become the problem. Direct pressure is not optional, it's survival law. Press hard, continuously, and don't keep checking. Every time you lift your hand, you restart the bleeding. If you have cloth, use it. If it soaks through, add more. Never remove the original pressure layer. This works because blood clots need stillness and compression to form, and pressure mechanically collapses damaged vessels. This section is based on practical field survival experience rather than formal academic sources. If blood is pumping or pouring and pressure isn't enough, this is when people panic or freeze. Don't. A tourniquet placed high and tight on an arm or leg can save a life, and modern survival medicine is very clear on this. Loss of limb function is preferable to loss of life. Tighten until bleeding stops, not until it's uncomfortable. Pain means it's working. Mark the time if you can, because prolonged tourniquet use damages tissue, but in a world that's ended, the priority is making it through the next hour, not the next decade. Tourniquets work because they completely stop arterial flow, buying time your body cannot create on its own. Now here's the part movies get wrong: do not dig for the bullet. Ever. Removing a lodged projectile without surgical control causes more bleeding, more tissue damage, and introduces contamination. A bullet that stays put is often tamponating, plugging, the wound it created. Pull it out and you may open a vessel you can't close. Your job is to protect the wound, not explore it. Cover it with the cleanest material you have, even if clean just means less dirty than everything else. Infection thrives in warm, wet, oxygen-poor environments, which is exactly what a neglected wound becomes. Keeping it covered reduces bacterial load and slows contamination, even without antibiotics. Shock is the killer nobody recognizes until it's too late. If the wounded person feels cold, shaky, nauseous, confused, or strangely calm, that's not bravery. That's the body diverting blood away from the skin and brain to keep vital organs alive. Lay them down if possible, elevate the legs unless there's a chest or head wound, keep them warm even in summer, and keep them still. Movement increases heart rate increases bleeding, and bleeding accelerates shock. This works because circulation is finite, your body is making hard choices, and you need to help it cheat in your favor. Chest wounds are different, and they're terrifying for a reason. Air can be sucked into the chest cavity, collapsing the lung with every breath. If you hear a sucking sound or see bubbling blood, you need an improvised seal, plastic, foil, anything airtight, secured on 3 sides. That allows air to escape but not enter, reducing pressure inside the chest. This isn't improvisation for drama, it's basic pressure physics. Lungs only work when pressure gradients are controlled. This section is based on practical field survival experience rather than formal academic sources. Over the next hours and days, infection becomes the enemy. Redness spreading outward, heat, swelling, foul smell, fever, these are not minor problems. They are warnings. Clean the surrounding skin gently when you can, keep the wound dry, change dressings only when necessary, and never seal a dirty wound completely closed. Trapped bacteria turn a survivable injury into sepsis. In a dead world, prevention replaces cure. Here's the final truth nobody likes to hear. Sometimes survival means knowing when not to move. Traveling with a bullet wound increases bleeding, worsens shock, and raises infection risk. If you can secure a defensible, clean place and let the body stabilize, that patience can be the difference between recovery and collapse. Your body wants to live. Your job is to stop sabotaging it with panic, myths, and bad movie logic. Because when the world has ended, medicine doesn't disappear, it becomes brutally simple. Control bleeding, protect tissue, prevent shock, reduce infection, and above all, understand